Welcome to Interdisciplinary Case Miles, a podcast where real runner stories meet clinical expertise. We discuss real cases that are anything from weekend warriors all the way to elite athletes, while using our evidence-informed approach.
I'm Dr. Sara Raiser, a running medicine physician focusing on helping runners prevent and recover from running-related injuries while optimizing health and performance.
I'm Kelsey Pontius, a sports dietitian helping runners to fuel smarter, recover better, and help avoid the risk of injury so that they can meet their goals.
And I'm Dr. Mihevc Edwards. I'm a physical therapist and orthopedic specialist, and I've been treating for runners for over 15 years. And what I do is help them get back stronger and better. Hi, everyone. Welcome back to another episode of Interdisciplinary Case Miles. And we are so glad you're here today. Hi, Sarah. Hi, Kelsey.
Hi, Kate.
We are going to jump right in with a pretty popular case. So this is a topic that is talked about a lot. I have a lot of patients that come in with this issue, and I know that you do too, Sarah. And I know that in your circles, Kelsey, this is like one of the injuries that a lot of people deal with for a very, very long time. So our case is about plantar fasciitis, and it is a 42-year-old female runner. So this runner runs almost every day, sometimes 6 days a week, sometimes 7 if she's super stressed, but it's like 3 to 5 miles. She uses her running as a way to mitigate her stress from work. She has a pretty difficult job that requires a lot out of her. And she has been dealing with this plantar fasciitis for over a year, but she really hasn't sought out help. She's mostly looked up things on the internet and asked her running partners, and probably has a zillion different things she's ordered from Amazon because she has tried to fix it herself. But what happens is she gets up in the morning and she's hobbling to the bathroom, and she's having a lot of pain in that heel. And then by the time she's, brushed her hair, brushed her teeth, done all the morning things, and, come out of the bathroom, the pain in the foot is pretty good until she sits down at her desk because she works from home. And she works for a few hours. She gets up to get a cup of coffee, and then she's hobbling again. And it's really bothering her, and it's getting worse at this point. It's been a year of like, oh, I can kind of ignore it because it's not really bothering my running a whole lot, except for the beginning. But now when she goes out for her runs, it's painful at the start of the run. It goes away a little bit, but she gets about halfway through and she starts to feel it again. So this is something that's definitely getting worse over time. And on top of it, she is a vegetarian. So we're going to talk about what does that mean from a fueling standpoint when we have somebody that has a diet that's a little bit more strict. So I'd love for you to start with this, Sarah, and jump right in.
So this particular case, it's not super uncommon that they come into my clinic and say, hey, can I just have a steroid injection so I can get rid of this and move right on? And usually I'll say, well, we'll revisit that. Let's talk about a few other things first. But there's so many different layers to this type of injury. And we'd call it plantar fasciitis frequently, but really it's truly a fasciopathy or a fasciosis, meaning this is a chronic injury. And sometimes there's not even a whole lot of inflammation that's associated with it. So a plantar fasciitis that, someone did a 10-mile hike and they weren't used to it and things flared up. That might be plantar fasciitis. And maybe a steroid injection would be helpful for that case. If they're otherwise young and healthy and it's just not getting better and they've got things to get to and talk about risk benefits, blah, blah. So that could be a scenario where that's appropriate. I do actually sometimes have scenarios too where there's a level of inflammation and we can put some steroid in that area, calm down the inflammation, and it just kind of nips it in the bud and they go through therapy and do well and move on. But I will usually give that a singular try. And that's for someone who has not had off and on again symptoms for quite some time. And I'm talking 6, 12 months. Sometimes it's been several years that they've had these symptoms before they actually come in because they've been able to kind of just gut through it and grind through it. And they don't have pain while they exercise. It's just the pain every time they get up, which can be a lot, but oftentimes they can kind of muster through it and do the things they need to do. So when I have someone with a plantar fasciopathy, it's been chronic and they're at a point where they want to do something about it. We talk about a lot of things. So we talk about the importance of having strong muscles in their feet. We talk about the entire biomechanical chain, kinetic chain. We look at their gait. If they're a runner, I definitely want to take a look at their run gait and see what we can do to mitigate anything that's going through the heel. I will oftentimes also do a diagnostic ultrasound and take a look to see if there's there's a tear? Is there thickening of that plantar fascia, which is diagnostic of plantar fasciitis? Sometimes I'm usually getting screening x-rays, which sometimes look totally normal. Sometimes they'll show a little bone spur. And just for the record, oftentimes the bone spur is not actually an issue, but it tells us that this has been going on for a very long time. So you get tugging of that plantar fascia at the site where the bone spur develops, and basically it's the bone responding to extra tugging and pulling at that site. And the same thing happens in a lot of parts of the body. An MRI potentially could also give us more information. Are they stiff? Do they have arthritis in other parts of the foot? Are there other reasons for the foot mechanics not to work right? So really looking at everything from a comprehensive standpoint throughout the foot, but then also, like I said, up the chain. So also taking a look at their back. Oftentimes when there are foot problems and ankle problems, there are also back problems. And especially when we're looking at someone in their 40s, sitting a lot throughout the day, I definitely want to make sure there's not a big component coming from there as well. And so we may potentially do some screening from that standpoint. PT is going to be one of my biggest first lines. I will usually give them a handout, have them start on some things like some toe yoga, intrinsic foot strength, some gentle stretches. But ultimately, the stretches are oftentimes not the biggest piece of this. It's the strength. And that's one piece that we usually counsel on quite a lot. Some of the things in terms of actually working on soft tissue manipulation. And I love doing massage mobilization of the posterior chain, so your calves and other places, to try to reduce stress through the foot. But ultimately, it's the long-term changes that we see with the strengthening and changing mechanics that are going to help with their pain down the line. So we have conversations about this is going to take some time, especially when an injury is chronic, which is most of what we all deal with is chronic injuries. We change biomechanics before we often start seeing changes in pain levels. And we know it takes around about 6 weeks or so to really start seeing changes in strength. And then we've also got neuromuscular changes on top of that. And then we can potentially actually see gait changes, and then see pain relief changes. So I really tell people we got to take some time with this. We want to get their acute pain levels down, and we talk about ways to do that. Sometimes that's anti-inflammatories by mouth or topical. It might be putting some cushion in the shoe for a little while, or even booting if they're having a lot of pain. So a stiff walking boot. But I really try to minimize how much we're doing all of that, wrapping the foot in bubble wrap, so to speak. As soon as their pain levels get better, we actually want to get the foot to start really doing its work. So I'm going to pass this off to Kate, because essentially what I would do from here is send them to PT. Once we can control pain, we want to send them on. But I really want to try to avoid putting steroid around that plantar fascia, just because we could potentially risk, helping to create a tear or other injuries, or just giving them very short-term pain relief, and pain comes right back when they haven't addressed the other pieces.
Sure. So the first thing I want to say is that rehab for something like this can be anywhere from 6 months to 9 months or longer, depending on how long it's been happening. And that is a really hard pill to swallow. And nobody really wants to do rehab that long. You get bored, you burn out on it. So having to be creative in a situation like this is really important. So what we might do is we might see someone in the beginning a lot more frequent. Well, for me, it's once a week. It's pretty frequent. But then you would back it down as we were working through this, and as they were working through the strength, and as they were doing certain things. You might go every other week, or you might go 3 weeks, and then but stay through that period of time that it takes to get better. Because, like Sara said, some of the strength changes take a lot of time to happen. So we get neuromuscular changes within that first 4 weeks. That's why people start to feel better, but it takes often 8 to 10 weeks to truly strengthen a muscle. And so if somebody is calm, has enough, they're calm enough, they're not too flared up, and you've done the manual therapy that you need, we may take time in between so that they can work on that strength of the things that we're working through. With somebody with plantar fasciitis, I do a lot of manual therapy in the beginning, a lot of soft tissue in the foot itself. I do a lot of dry needling in the calf and hamstring, obviously lumbar spine, and sometimes even thoracic spine. And I'll do the cervical spine if there's a neural mobility component, which there usually is with something like this, especially if it's been this chronic. Whenever something is chronic, there is usually a neuromobility component of it. And so we'll work through that, because what we want to do is we want to offload the plantar fascia as much as possible. So we can do that by improving the mobility of the lower leg and that kind of posterior chain. One of the things that we see a lot is that when you think about when the foot hits the ground and then push off for running, so when your foot hits the ground, it has to go into pronation. So it's like an unlocking mechanism to absorb force. And then it has to go into a supinated position, which is like a rigid lever to push off. And so if somebody doesn't have great toe extension, that can be a problem. When we extend the great toe, what happens is the fascia actually becomes tighter, and that helps to make that rigid lever and push off. So I'm going to be looking at great toe mobility and kind of seeing how that is. I'm also going to look at pronation and pronation, supination, but dorsiflexion and plantar flexion, which is like whether your foot goes up or down. Because a lot of times if you're lacking dorsiflexion, so that kind of where your foot goes up, then what's going to happen is you're going to roll more into that pronated position and load that plantar fascia even more. And you might actually even end up with bunions if that's something that's happening over time. So if you can't control that pronation, eccentric part of pronation, then you're going to load that plantar fascia and you're going to create like that situation for bunion and where your foot kind of goes in. So we're going to be doing strengthening of the feet, just like Sara said. So hopefully they've started on it with her. And then we'll get more specific and we'll load it in more creative ways and like with single leg loading, making sure we're maintaining that arch as we're kind of going through everything. And of course, we'll look at shoes and orthotics. One of the questions that is often asked is, do I need orthotics if I have plantar fasciitis or fasciosis? And the answer is maybe, maybe not. So if you're somebody who needs a little bit more support, I might give it to you with an orthotic or with a shoe change, but knowing that that's not forever, because we want you to strengthen that foot and we want you to be able to control how that foot moves through pronation and supination. And then the other question I often get, and I'm almost done because I feel like I'm doing a monologue here, is that why is this pain worse in the morning or after I sit? And the reason that happens is the tightening up of everything. So tightening up of the calf, tightening up of the plantar fascia. And so doing some things at your desk could be really helpful. So doing some stretching. So strengthening is more important than stretching when it comes to this. But there are times when you want to do some stretching. So you could stretch out the gastroc and the soleus, which are calf muscles. And you can actually do a self-stretch where you're pulling your toes back in your chair and kind of rubbing the bottom of your foot. That does help with that transition from sitting to standing. Kelsey.
And we talked about this before in our other cases, that there's always stuff we can do in PT for just about any injury, right? But this is one that I want people in like yesterday, because there's so much to work on that's oftentimes does not involve the painful pieces.
Well, I think it's hard. I mean, Kelsey, you've talked about this before. Like PT is one of those things, like you have to mentally get there to be able to go. And then you have to be able to you have to be with a PT that gets what you're trying to do as a runner to help you through that process, because it is exhausting. There's no other way to say it. Injury is exhausting. It's a huge mental load, and you have to be with a provider that can help you through that and know like when to modify. Okay, why don't we do 2 weeks instead of 1, but make sure that you stay on top of your things. So I think there is that component of it too when it comes to injury.
And definitely this one, the single leg exercises. I just wanted to say, sorry, Kelsey, there's so much to talk about in this case. But they've got to do the single leg exercises, right? And
with the arch.
Yeah, it's super important.
Yeah.
This is the first running injury I ever had. I had a training for my first Olympic trials, and I can attest to, I think it's so easy too for it to come on gradually and you to normalize it, because then it does start as like, I just woke up, but it's fine when I'm running. And then it takes like it progressing into runs for or at least for me to take action. It was like, oh, but it warms up after mile 1, and then it was mile 2. And then before I knew it, it was like, it hurts my whole run and it's getting worse throughout the run. And so I think it's one of those injuries that, maybe it's sometimes like I think that a lot of runners have plantar fasciitis and they're like, oh, you can run through it. And so that was like one of the biggest culprits of me not addressing it. And I let it go way too long. Okay, so as far as the nutrition strategies for plantar fasciitis, I was a dietitian when I had plantar, but I did not know what I know now about injury healing. Of course, to not be a broken record, I'd take this person through like a normal collagen resynthesis, protocol, making sure that they're eating enough, making sure that the protein is adequate, and then the other micronutrients that I've talked about before, which is like the zinc, the copper, and the vitamin C. I have seen, this is so anecdotal. I don't think that there's actual literature, but I have seen a lot of my vegetarian clients having like lower foot plantar injuries. So I don't know exactly what it is, but I thought I would dig into like kind of what the composition of nutrition, why it's different in a vegetarian diet. So first of all, we know that what we call the bioavailability of the amino acids, or just simply the amount of branched chain amino acids in animal versus plant protein, is a little bit different. And so oftentimes when vegetarian clients come to me, I'll calculate out their protein needs to be a little bit higher, because it takes more amino acids to meet a threshold where we're stimulating that muscle protein synthesis. Oftentimes in vegetarian diets, the limiting amino acid is leucine, and that's the one that's solely responsible for muscle protein synthesis. Also, we know, I think we said that this patient was in her early 40s, so already she's going to have higher protein needs. So I would do that first, making sure that her protein intake is adequate, that she's spacing the protein throughout her day, and that I'd probably push her to eat the dairy and the eggs that have a higher amount of these branched chain amino acids. And then I've talked about the micronutrients involved in collagen resynthesis, but I wanted to talk about a few other ones that I haven't talked about on a podcast that might be relevant for this injury. So vitamin D is another one that's critical. We see higher re-injury rates with vitamin D deficiencies. It's always good to work with your physician to establish, do you have a vitamin D deficiency? Oftentimes we just think bone with vitamin D, but we know that there's this tendon-bone relationship, and kind of just lapse in healing when there is a deficiency, even in tendons. And then magnesium is really, really cool. When I used to not know the answer on a test when I was in school, if magnesium was a choice, I would guess magnesium, because magnesium has like billions of functions in the body. It is honestly it's my favorite micronutrient. And there is a role with magnesium with muscle fascia coordination, which is really, really cool. And so just making sure, we would think with a vegetarian diet that someone would be consuming enough magnesium, but I thought that it could be a cool thing to bring up. And then something that I also consider, what is there a relationship between vegetarian diets and these like lower extremity injuries, is the B vitamin content. So B12 specifically, which is mostly in animal sources of protein, you can find it in milk and you can find it in eggs. So if this person was consuming those food sources, then less of a concern than a vegan. But B12 itself is responsible for red blood cell formation, and then also to like other B vitamins such as like B6 also have roles, and vitamin D2 have roles in pain perception actually. And so oftentimes when there's a micronutrient deficiency, the perceived pain is a lot higher. Not that we don't believe this person is having pain, but just out of curiosity, are these contributing to higher amounts of pain in this person?
And also, does dry needling hurt more if they don't have them?
Oh, yeah.
That's interesting. That would be interesting, because this is someone I would, do dry needling because I can in Georgia, but I would do it in the foot, like in the the quadratus plantae, as well as the actual calf. I wonder if it would be more painful. So that's super interesting.
Needles in the feet.
Oh no, that's terrible, but it can be life-changing too, if it really hurts. The other thing that we kind of briefly touched upon, but is for a person like this who's been paying for a long time, and their number one way of relieving stress is running, and they're not able to do it in the way that they're used to. So they're not maybe meeting their girlfriends for coffee after the run, or they're not running with them and getting all their stress out, or whatever it is. I would want to make sure that we address this piece. And so I often when I'm working with clients, make sure that they're telling me what are they doing for fun outside of their sport. What is it? And that's homework. It's often homework. I also give meditation as homework and breath work. Anything I can do to get them out of that kind of that mental brain piece and kind of calm the nervous system down can be incredibly helpful. And a lot of people hate it, of course, and they don't want to do it. But once they do, they realize that it is really beneficial. Unfortunately, I learned that the hard way a long time ago, that I was a person that didn't want to do it. And when I started doing it, I was like, oh, this is really helpful and everything feels better. So I did want to address that. And if it gets really hard and they need to talk to somebody, I might send them to a sports psychologist just to kind of talk out like strategies of what they can do around this injury that can help them. And sometimes even, I know as a physical therapist, like one of the things I like to do with someone who's been, all of my patients, but definitely someone who's had a chronic injury, is I make sure that I'm writing the goals with them and really talking to them about it, because making sure that I'm pulling them into the process a little bit more so that they have more buy-in and they're more engaged. And also just asking them, like, what's the most important part of this rehab process for you, especially if you are so sick of it? Like, what is it that we can do here that's really going to fill your cup in terms of getting better? So those are really important conversations. And sometimes we don't get to that part on these podcasts, but it is a conversation that I have with every injured athlete, and we do talk about it. And I think it's important to address.
Yeah. And I think for any providers that are listening, I mean, one or two questions can oftentimes give you a gauge of what's going on with this. So finding out what they're doing outside of their sport and activity, do they have other hobbies? And then even asking, that's a great point, Kate, is asking like, do you typically run with groups, or is it a social thing for you? Maybe they can go to the gym and do a little bit of support, get on the elliptical with you, that sort of thing. And so I agree. I think sometimes it gets thrown by the wayside because there's so many other things to talk about, but especially my patients who spend time non-weight bearing, we definitely hit this. Usually that's not the case in plantar fasciitis, but I always, when I put someone on crutches or make them non-weight bearing, we have this conversation about how do we fill this time and help support mental health, because it's not easy for anyone, especially someone who's active. And I had someone mention one time, they're like, well, gosh, I mean, like, why did this happen to me? I'm so active. I'm like, well, but that is why it happened, because you're an active person. These are why we get overuse injuries, right? So you're the exact type of person to have this happen to. And it's really hard to manage from a mental health standpoint because you've been managing through all the activity. So I'm glad you brought that up, Kate.
Yeah, I actually created a coloring book for my athletes. I give it to them a lot of time. It's a running coloring book at my clinic, and it's published everything. I don't think you can get it anywhere but my clinic, but I created it so that I had something to give my athletes to do if they couldn't think of anything.
Oh, there might be a lot of people coming to your clinic next week.
You can order it online, I think. I don't actually know. I have to ask Kay. I think you can order it online at my I don't know, probably one of my websites. All right, let's wrap this up, ladies. So please, Kelsey, tell me your top one or two things.
Ooh, making me go first.
Sorry.
I think that just kind of knowing, you've heard me talk about so many micronutrients, and I know that as soon as I said magnesium supplements were having a moment in the last 2 years. I definitely meant food sources. And I think that with all of these micronutrients playing key roles in injury healing, just remembering that it's really, really hard to get to them all. It's kind of like you're playing whack-a-mole. If you're trying to out supplement all of this and take supplements for everything, and your best chances to make sure that you're not missing micronutrients is to eat enough and add variety into your diet.
Awesome. Sara?
And I realized a couple of things I didn't mention. Number one, there's certainly procedures like PRP and the percutaneous tenotomy, which we talked about in another episode, that are options if things are not getting better to kind of give a kickstart. And then shockwave or extracorporeal shockwave therapy can also be really helpful for treating this. The nice thing about the shockwave therapy is you don't have to shut down to use it in terms of your activity level. It's painful while you do it, but as soon as you remove it, oftentimes you get some even short-term pain relief with it as well. Main downside is just out of out-of-pocket expense, but I think there's a lot of value to that as well. There aren't other contraindications. I think the biggest thing for this one is really this is very much a comprehensive approach, and I think oftentimes this is the injury that the person who's running a couple miles a few times a week has. And so sometimes we forget to look at that really big picture piece of it and looking at the stress and their shoe wear and the whole kit and caboodle. So just remembering everything is influential here when we're dealing with plantar fasciitis.
And mine would be, this is going to take so much longer than you want it to, and I'm sorry, but hang in there because you don't have to have it forever. It doesn't usually last forever if you can get it treated. And make sure that your patients are part of the process because it is so long. It's so much more important to rope them along, help them make decisions with you, and you're not just making decisions at them, so that they really do feel supported. And there's a lot of PT things I could say, but I think that's the biggest piece. So thank you everyone for listening. And we are so happy to have you here. If you like this podcast, please follow us, like it, send it to your friends, to your family, to your coaches, anybody who you think might listen to this or benefit from it. And if you've only heard this episode, check out our others. And if you have a case that you want to submit to us, we also take cases. It's runcasemiles@gmail.com. And we look forward to talking to you soon. All right. See you later.